Hello, I'm Austin Heyman. Welcome to Seniors Today, a monthly program produced by the Commission on Aging, devoted entirely to issues and interests of Montgomery County seniors. This month, we learn about opportunities for seniors to take advantage of the many facilities and programs offered through the county's Recreation Department, and highlight the recent gathering celebrating the first anniversary of the Senior Summit. But first, we begin with a concept generating more and more discussions these days: aging in place. And joining me to explore this concept are Elaine Binder, who has chaired the Commission on Aging's Health and Wellness Committee, and Kenneth Hartman, the director of the Bethesda Chevy Chase Regional Services Center. Well, welcome to Seniors Today.
Thank you.
Elaine, the Commission had a study, I believe, this summer on aging in place. What is aging in place?
Well, the study came up with what I consider a really good definition of aging in place. And what we said was aging in place is a choice made by older adults to remain independent in their community and or their homes, living with or without assistance. We were quite clear that this was not only living without assistance, but the fact that in order to do this, people would want to have assistance, and that assistance would really include things like transportation, health and issues of health and safety, social engagement, and services that the county, that Montgomery County, many services that Montgomery County already does provide, but certainly other services that the county needs to explore.
So it's not just, I mean, I think most people think of it as being in your home, but you're saying that really it's being in your home or being in the community at large.
Yes, it is. And it's not really moving to one of the continuing care retirement communities or someplace new or outside of the community. It's really it's what people want to do. When you ask them, where do you want to be as you grow older, what they really want to do is they want to stay in their homes, or they want to stay in their neighborhoods or in their local communities.
Now, Bethesda seems to be very interested in this topic, Ken,
Very much.
and you've been immersed in it. But first, tell folks, because not everybody knows what the Regional Services Center is.
Well, regional service centers are the field offices for county government. The directors of the regional centers are the county executives' liaisons to the local business and residential community. So we hear a lot of things. We interact on a grassroots level with our communities, and we learn of service needs, and we begin the planning process for how to fill those service needs.
So you learned that there was a need for some
Absolutely.
work on villages, and I don't know how many villages there mushroom. I mean, the first one I heard about was Burning Tree.
Well, we have Burning Tree, we have Bannockburn Neighbors Assisting Neighbors, we have Cadman John Neighbors Assisting Neighbors, and Chevy Chase at Home. And these are villages that are actually have organizations and are beginning to provide services to the residents.
And what have you learned? There have been a number of meetings, I know, of these villages. Mm-hmm. What seems to be the predominant concerns or issues or interests?
Well, the predominant interests, these villages came out of a desire from residents to stay in their communities and how to assist each other in doing that, which is, to me, the epitome of what a civic community association should be. It's about creating a community. So these groups, some of them are looking at all volunteer models, having a list of people who want to take folks to go grocery shopping, who organize social opportunities, who can pre-screen contractors. And then you have folks who can access the services. So these groups marry up those two populations. To now, 3 of the 4 that I mentioned are all volunteer-based. The fourth, Chevy Chase at Home, is looking at a fee-based model where they would hire an executive director who would manage the day-to-day operations and services.
And that's more, it's somewhat similar to the original national model that people have written, the Beacon Hill model, which does have a significant charge to belong and executive director and so on.
The village concept is really an important one, and I assume that it works well when there's a greater density of older adults living in a particular geographic area. There are apartment buildings that are considered naturally occurring retirement communities,
right.
and providing services on that kind of a basis would be very good. But a large part of Montgomery County is really, it's a geographically dispersed area. There are many different communities where there are diverse communities, diverse individuals living, and there's large geographic distances. And so the village concept, from my point of view, is a wonderful one that does work with as greater density, but we also have to think about the rest of the county
Right.
and realize that
I think that's a challenge moving forward as we deal with these inside the Beltway neighborhoods. How do we then take the lessons learned and apply them to neighborhoods and work with neighborhoods that are more spread out, even in rural areas of the county? And something that we have to, as a county, think about. How do we then support other neighborhoods and with other characteristics?
Right, I agree with you. I mean,
Well,
I just don't think that you can take that village concept and move it
It's not a
up
cookie
county.
cutter. And in fact, what we're seeing, these groups that we're working with now, each one is different than the other.
Well, in a way, the summit issues that were dealt with, I think you sort of identified some of them. The summit, senior summit, that dealt with 8 different, well, really 7 substantive areas. And you mentioned like transportation, civic engagement, employment, safety,
Exactly,
housing. And in a way, I think maybe you were suggesting that if you worked on those areas, you would be providing the support that you would need if you didn't have if the village was considered the county. I mean,
Exactly. And one of the things that the Commission has done, the Commission has identified aging in place as a priority for the Commission. And one of our ways of moving that forward is to look at the results of the various work groups that emerged from the Senior Summit and see to the extent to which they support issues that are important for aging in place. And so we're really going to be looking at that work with a somewhat different eye. I mean, obviously the work is designed to encourage seniors to stay in Montgomery County and to make Montgomery County a livable community for seniors, but we're also looking to see how these services can be provided along the county lines.
Well, one of the issues that I've attended some of these meetings, it seems to be transportation.
Right.
For the Bethesda villages as well as I mean, transportation it seems like an overriding concern. I mean, we have, of course, public transportation, but in some areas it's more challenging.
And that is the top challenge identified by these groups that we're working with. We've listed out all the different issues that they face, and providing transportation for their residents to grocery shopping, to doctor's appointments, just getting about your daily activities is their top priority. They're all trying to look at different ways to provide that service to their residents.
Right. I actually serve on the transportation work group, and one of the things that we've done over the past year is look at how we can make Montgomery County transportation more accessible, but we're looking at buses, at ride-on, at things of that nature, pedestrian safety. And I think it's going to be very critical in the year ahead that we look more closely at alternative transportation efforts. And that's going to be extremely important because a bus doesn't go into every single neighborhood.
Right, and the promise of these villages is that through neighbors or volunteers helping folks get around the community, that helps our overall transportation opportunities for seniors.
Yeah, I guess they've explored the whole question of liability issues and people being available to drive as a volunteer, and then of course I think one of the groups has partnered with the Senior Connection, which is an organization that
Burning Tree Village is partnered with Senior Connection. Senior Connection trains all the volunteers. They cover the liability needs of the volunteers, and they're a point of contact for a resident in the neighborhood who wants to get out and go grocery shopping or go to a doctor's appointment. They call Senior Connection, and Senior Connection matches them up with a volunteer.
I think that's a wonderful way for us to expand the whole transportation into neighborhoods and moving people from one place to the next.
Absolutely.
But of course that's only one piece of the puzzle.
Absolutely.
Yes.
absolutely. There
so,
are multiple
so the
ways.
Commission is going to continue in the coming year to focus on some of these issues.
Yes, it's going to be very high priority for the Commission to look at that and to look at some of the other issues too. I mean, we've looked at safety issues, we've looked at other areas, socialization, things of that nature, and we will also be partnering with the Vital Living Committee to work together, because I think that it's not just the Commission, it's the county government, it's the Vital Living Committee,
all
it's all of the
stakeholders.
stakeholders are concerned about what we can do to improve and maintain and improve services for seniors in the county.
And meanwhile, in Bethesda, you're going ahead. You're about to produce a toolkit, I
That's
believe,
right.
to help other.
A village blueprint, as we.
So others can
Exactly.
learn from.
Just take all the lessons we've learned and publish it out there, and work with other communities that may be thinking about this opportunity.
Well, I think we're going to have to continue this discussion over the coming months and years.
I hope we will.
Thanks very much for
Thank
coming
you.
in. When we return, we'll find out about opportunities for seniors with the county's Recreation Department. So please stay with us. We'll be right back. Welcome back to Seniors Today. From travel activities to hundreds of classes at senior and other centers, the Montgomery County Recreation Department offers a long list of programs specifically for seniors. In fact, if your New Year's resolutions include taking a more active role in your physical well-being, then you'll be very interested in my next guest. He is Gabriel Albanez, the director of the Montgomery County's Recreation Department. Well, welcome to Seniors Today, Gabe.
Hello, Austin. Good to see you again.
And there's a lot going on. What is this? I've heard about this Silver Sneakers program, and it seems like a lot of people are going, what is it?
Well, it's been a very successful program for us. We implemented it this past year. And basically, we've made all of the weight and exercise rooms in all 18 of our community recreation centers across the county free for older adults, 55 and up, from 9 a.m. to 2 p.m.
That's terrific.
It has been a wildly successful program. It has tripled the amount of participation at our community recreation centers during those times. And that's exactly what we were trying to achieve through the program. And we've gotten a tremendous response and a lot of positive feedback from participants of the program.
And I suppose once they come, they can find out all the other things that are going on.
You got it, you got it. And the other thing that we try to do is offer classes and instruction, yoga classes and the like. And seniors are now actively participating in the program and finding out, as you said, about programs that they didn't know existed, which has been fantastic for us.
I mean, another popular area I think that a lot of people don't know is the Aquatic Center.
That's
right.
well
used, isn't it?
It is very well used. Our 4 indoor aquatics facilities are open year-round, 7 days per week, 17 hours per day, 364 days a year.
Wow.
And they are very popular programs. We have class instruction, but we also offer, obviously, just recreational and open swim opportunities. And I actually recently pulled the numbers, and we have over 3,000 seniors registered to actually participate in class instruction over the course of the year. And so it is very popular, and if you go to any one of our indoor aquatics facilities during the day, you'll see that predominantly the participants are seniors.
But you mentioned some of these other classes. There's a lot of different kinds of classes. I mean, I looked at you have the book that you can get at the library that
Yes.
describes all the programs.
Yes.
And then you have a website, too.
We do. We have a website, which is linked to the county's website. It's, of course, www.montgomerycountymd.gov/rec, REC. And there you will be able to find out about all of our programs. But in addition to that, we also offer the Parks and Recreation Guide, which comes out 4 times a year and also includes a listing of all of our programs and class instruction that we offer at all of our recreation centers throughout the year. And again, as you said, we offer a variety of classes, from cooking instruction to exercise kinds of classes. We also offer a number of trips that we advertise through the Recreation and Parks Guide. So there's literally something for everybody, which is something I'm proud of.
Now, you mentioned some of the things are free, but some of the travel, there's a cost involved.
That's right. That's right. Most, the Silver Sneakers program is one of the programs that is free. It is also free to just simply come into our community recreation centers and take advantage of some of the open gym time, etc. But in addition to those free opportunities, we do offer classes and, as I said before, the trips. And there are two kinds of trips that the department offers. One are the senior mini trips, which are more locally based trips, typically cost between $15 and $25. Those trips include, things like going down to the Cherry Blossom Festival, as well as traveling to our local library system. So it helps a lot of seniors that aren't quite as mobile and to connect them to some other county services and programs. But then in addition to that, we have the Senior Outdoor and Adventure and Recreation programs, which are very popular. In fact, this year we had a waiting list of over 400 seniors.
Oh my goodness.
And those trips often involve trips outside of the county. We will visit vineyards. We will take a tour of Monticello. We've offered tours of the White House in the past. And so typically those programs are between $40 and $60, which includes travel and expenses. But those programs have proven to be very popular as well.
You also have a lot of partners who help you with some of these programs. I know it's Arts for the Aging is one of them.
Yes.
You have partnerships with some of the hospitals, don't you?
That's correct. Partnerships is the way that we've been able to survive. I have been telling folks, our staff, particularly our senior staff, has been making $1 out of 75 cents for years, and that's now becoming about 50 cents. And so the way that we've been able to thrive and really expand our programs is through partnerships. And facilities like Holiday Park, Damascus, and Schweinhout, and Long Branch really wrote the book on establishing partnerships. And not just partnerships with community-based organizations, but partnerships with sister county agencies as well, libraries, HHS, transportation. We really do leverage the resources and expertise that we have, and the hospitals have been a great partner. As you said, Suburban Hospital in
Senior
Venice.
Fit is one of those programs.
That's right.
That's a sort of a formal exercise program, isn't it?
Correct. We have that program, because of the partnership, is free. And so we do offer that at our senior centers. And that is a drop-in kind of program where seniors can come in and do various calisthenics and that sort of exercise, some stretching exercises. And it's led by a certified instructor. And one of the things that I have really found within the healthcare system, particularly now, and you see this during the whole national healthcare debate, is that there really finally is a premium being placed on prevention-based healthcare.
Right.
And so we are well positioned as a department to be able to provide the kinds of services that are in line with that thought. And so prevention-based programs is what, frankly, we're all about.
Right.
And hospitals and also corporations and companies have really started to understand the value of prevention-based programs and are actively seeking us for partnerships, which is exciting.
Now you have quite a lot of facilities. I know we talked about the senior centers that like Holiday Park and Damascus and Schweinhout and Long Branch. And then there are the community centers where you have senior programs and neighborhood programs as well. And then I guess we should mention, of course, the city of Gaithersburg, Rockville, there's
Tacoma Park.
There are other, so all over the county there really
Yes.
are programs that one can take advantage of.
That's right. The municipalities also do an excellent job of providing recreation-based services for their constituents, and we often partner with them in a variety of areas. But that's one of the great things. As you know, this is a fantastic county. It's a great county to grow up in. It's a great county to live in. It's a great county to retire in for those reasons, all of the wonderful amenities, the resources.
And before we run out of time, I want to mention the Senior Olympics.
Yes.
That we've had on the show before.
Absolutely.
You're going to continue that this year.
We are continuing that program. It has been very successful. We're entering into a qualifying year, and so seniors that qualify with their times and in their participation will actually be able to qualify for the National Senior Olympics competition. And I'm not sure where it's being held next year, but last year it was at Stanford. And so it's competitive, but at the same time, we just encourage overall participation.
Well, you've got a lot going on.
We do.
It's very exciting.
Yes.
And we want to take advantage of it, too.
Absolutely.
Thanks very much for coming in.
Thanks, Austin.
When we come back, we'll conclude today's show with a follow-up to last year's Senior Summit, so please stay with us. Welcome back to Seniors Today. On November 20th, 2008, County Executive Leggett convened the county's first day-long Senior Summit, held at the Universities of Maryland at Shady Grove. Attended by nearly 300 stakeholders, the county executive shared his vision of the county as it related to senior issues. Participants at the summit prioritized recommendations and then broke into work groups to brainstorm action steps. They produced 177 different action steps for further consideration. To mark the one-year anniversary of the summit, last November, the county executive presented an annual report back to the leaders and advocates from the senior community. You can find a copy of the report if you go to the county's website at www.montgomerycountymd.gov/seniors. Well, that's it for this edition of Seniors Today. As always, thank you for watching.
Looking for information on services for seniors? Caring for an elderly relative? Find information about a variety of Montgomery County programs, as well as resources in the community at www.montgomerycountymd.gov/senior. Without a computer? Call the Senior Resource Line at 240-777-3000. Monday and Friday from 8:30 a.m. to 5 p.m. and Tuesday, Wednesday, and Thursday from 8:30 a.m. to 7:30 p.m.
On April 1st, 2010, our nation will be counted. Every person, whoever they are, wherever they live. And what we learn will transform what we know about ourselves. The 2010 census, it's a new portrait of America. The 2010 census is an exciting milestone for America. It promises to deliver accurate information about our diverse and growing population. And it's important for the future of every community. Census data will be used to allocate over $300 billion in federal funds every year.
The 2010 census will be important to the nation because it is the foundation of our democracy.
The census, no matter when it is the consummate partnership between local, state, and federal government.
Communities use the data to plan for their future, like disaster and emergency services, healthcare services, schools, transportation, libraries, senior centers, and more. The 2010 census builds on the success of previous censuses and is the best planned and most well-researched census ever. And innovations, like a new short census form, will help to make it even more successful. The 2010 census, it's easy to complete. Data are always confidential and safeguarded. It's important.
This census is a commitment to the American way of life. To be counted as a resident of the United States, I think, is one of the proudest things that can happen to you in this country. It's important. Stand up for yourself, be counted, let people know you're out there.
The 2010 census, it's a new portrait of America.
A photograph, a time and place, a picture holds a moment's space, a portrait of hopes and dreams, telling the story of our times. And for now we know that we're changing fast, and for now it's clear that we've
the 2010 census. It's a new portrait of America.